So identifying a problem. Let me see if it is going to let me actually advance. So this is the outline of the project, identifying the problem, what the proposal fix, interventions, implementation, how to evaluate it afterward, the impact it has on nursing, the conclusion, and then a section for question, and then all the nuts and bolts of the details of where I got it from. So the problem identified. So upon meeting with different folks and talking with them on the unit, we found that there's just too many forms of communication at Duke Raleigh. Whether it's pagers, we have the landlines, we have our companion phones, there's secure chat, there's in person, there's Zoom, there's team meets, there's within the MAR, we have the separate one for talking with the pharmacist, or during the day shift, Monday through Friday, we have one person to talk to with the pharmacy, and it's different on nights and weekends. So lots of different forms of communication, and we're finding that people are at a lack for knowing who am I really reaching out to, where do I find the number, and it's spending a lot of time doing it. Sorry, I don't know where it went. There it goes. So why is this a problem? Again, it's a problem because you can delay in care. It adds stress for the staff. It can be a breakdown in communication. We can increase mortality and morbidity. It also increases the length of stay. Sharp et al. In 2019 said that there are too many forms of communication that leads to the feelings of being overwhelmed and adding too many tasks to learn how to use all these different forms. Just by like a show of hands, how many of you get frustrated that you're like, oh, I got to call this department. Where's the number? Where's the number? Where's the number? Or I wish it was just easier to do this. Or if you think about, you're sending out a page. I'm sending out my page. Look, yep, it's on our badge, buddy. Look at all those numbers to keep up with. We send a page to the provider because this provider prefers paging while this one prefers secure chat. You send out a page, you send your message, you hear nothing. You hear nothing. No new orders. So did they receive my page? Are they ignoring my page? Have they forgotten about my page? Yes, we all think that our patients are the most important, but there are other patients, rightfully so. But it just adds another layer of what about it? What about this? Just kind of thinking, did they miss me? Did they skip something? So the rationale behind this is to have one standardized form of communication for all the disciplines, so we can promote the safe and quality of care. I have several different references here from all different folks, but just for sake of time for this meeting, I am going to just let it be part of the PowerPoint, and people can review it if they want to. My teacher will just have to get over that. I apologize. So the goal is to provide, obviously, safe care, quality care, patient-centered care. This allows the nurses to build that trust, to be able to provide privacy and have integrity. We just want to do what's best for our patients, and we can do that by having this open communication. So the proposal is, it is proposed that the numerous forms of communication used at Duke Raleigh Hospital be reduced to just one form of communication to improve safe, timely, and the quality of the care that we provide. One of the studies by Goyle et al. Suggests that they were using two-way pagers to communicate, that it wasn't just meant for providers, for us to page out to providers, that actually having it for staff the same way that we use like secure chat, all of us can use it. It's something that's available to everybody who's within the Duke system. So some interventions. All disciplines can log into their, for their shift. So you show up for your shift, You log in, you put your phone number, your contact information, so anybody knows that, I'm attached to room 2210, they all know that I'm the nurse, or I know exactly who the provider is, or who the first call is, or who respiratory is for that patient, and so on. And we can set our time of availability. So if I'm there working a 7 to 7 shift, I know I can be reached. Versus a provider, a lot of times they're off the clock, or kind of charting, and they're not responding, that it goes to the next person at a certain time. Sometimes that's 4, sometimes that's 5. So we may not be able to reach that person. So if they just put in their time, we know, hey, it's not that person. Their name drops off. It goes to the next person that is put in for that time spot. And then also another intervention would be to have a department login. By this I mean, let's say, radiology logs in because this patient, maybe this patient is coming down for a study. Well, do they have to be NPO? Do I need a 20 gauge IV in order for contrast? Were they allowed to have somebody come down with them? Do we need an interpreter? So basic stuff that we don't necessarily need to be calling and pulling them away from, a patient that they're already with, and or, that phone's constantly ringing. How available are we for our patients if we're constantly answering that phone? So the secure chat form, just to ask a quick, simple question would be convenient. Implementation. So to implement it, new hires during the new hire process would go through the appropriate use of the secure chat. That would include like professional conversations and knowing what's right to talk about there and what's not. While it is not part of the medical record, it is discoverable. So if we say, oh, this patient's just being a wuss, he can't handle the pain, that's discoverable and probably wouldn't look so good in court. So just teaching the professional conversation there. And then yearly, like we have with most of our things, we have LMS modules where we kind of vamp the knowledge. And at the end of said LMS module, you'll fill out a survey. Was this helpful? Was this not helpful? Have you had better communication with the providers? Have you, it'll be like a whole evaluation system there on that system. And then we would remove other forms of communication. So drop off the MAR RX, secure chat form that's there in the MAR, because that's just another avenue of reaching out. Drop off the pagers, drop off all the things. So it would just be like secure chat and then the landlines. And the landlines would really be more for like emergency communications. For instance, when we have code black and stuff like that. We still overhead page code blues. We still overhead page, all the code scenarios. So secure chat, if everybody's logged in, it automatically goes to your computer screen if you're on it. It also comes to our companion phones, so it's not like we wouldn't get the message. Evaluations of this. So this section, if this was a true project, in this section is where we would put in graphs and charts of the information gleaned. So, looking back at SRSs to see, was there numerous SRSs on the secure chat, or after the LMS modules, filling out the survey for feedback. We would take the quantitative and the qualitative data to see, are we having, two like timely responses? What does that timely response look like? And, is it a 5-minute for emergency pages or messages versus, as long as it happens in an hour. So there'll be time sets. And this would just be the section where we would have the follow-up information as for all the information we gleaned. Impact on nursing. So standardizing the communication modality, the suggestion was the secure chat. You would have real-time communication. It's secure. It's patient-centered. It can be efficient. And it allows for quality care for the patients, their families, and their loved ones. And just a little mention here, the impact on nursing. The Joint Commission includes improving staff communication as one of the national patient safety goals. So, I mean, communication truly is key to everything we do. It really is. Conclusion. So, in conclusion, a sustainable, standardized, and effective manner of communication is imperative in maintaining a collaboration of care for all patients at Duke Riley Hospital, and a communication modality that can be used by all disciplines to maintain and facilitate health promotion with cohesiveness amongst the interdisciplinary teams is vital. And that is my any questions slide. So any questions, throw them at me, more than welcome to. I will say that the rest of the slides are just references in my appendix for all the lovely extra information I had.
A great job. I think the challenge would be to get everybody to use the one format.
Correct.
Because as you said, some like pages, some like secure chat, some like telephone calls, and as we saw even from our work culture results, even though we talk at huddles and we do one-on-ones with staff quarterly, and we have the weekly newsletter that goes out, communication is still an issue. So it's hard to find. I don't think there is one magic bullet, even though that would be ideal.
Yeah. There's lots of options out there, and I think making everybody happy in the same manner is going to be difficult, because you do have people who have certain preferences one way or the other. I agree.
Cassie, I'll just say that working in patient safety, communication is the number one contributing factor to medical errors. So
yes,
your presentation is right on.
Yes, it is. Well, and I have lots and lots of background information and quotes and feedback, but I mean, it's, they always say you should put in information that is not common knowledge and to quote it and stuff like this. To me, it is common knowledge, but then again, maybe not so much. But saying hypotensive versus hypertensive, maybe one letter difference, but or 2 letter difference, but could be all the difference in the world of what treatment you do,
Right.
So anyway, it was just a project on communication and the key to it, and trying to get everybody say more on one page, a little bit more cohesive. Thanks for letting me present that.